Good morning, everybody. This is the 13th lecture. Welcome. We will be talking today about vaccinations, fly control, parasites, the healthy horse, and when to call a veterinarian. I know that this doesn't seem to have anything to do with hoof care in the first moment, but trust me, it has a lot to do with hoof care and what all you can do either for your own horses or for those in your care by educating the owner about these things to make the horse's life better. And this is what this is all about. Some of you will absolutely agree with what I'm saying. And again, in this instance, I'm going to draw from a veterinarian, Dr. Madeline Ward, who has this investigated extensively and works in a holistic way with especially vaccinations. It doesn't matter if you agree or not really. It matters that you understand what is happening to your horse. When anything foreign, any foreign substance enters his body, it matters that you understand how this may alter his quality of life, which we talked last time about, and it also may alter his life expectancy. And unfortunately, there is a huge discrepancy between what we believe in and what oftentimes the veterinarian will tell you. So having said that, bear with me, it's a lot today again. I don't know why these things become so long and so extensive, but every time I make the outline, it becomes more, and then I work a little bit on it and it becomes more. So let's get started, and we will discuss everything that concerns you afterwards. Dr. Madeline Ward wrote in 1997, "I was taught in veterinary school that vaccinations could do no harm and were very effective in preventing disease. For the first 10 years of my practice, I encouraged owners to vaccinate for encephalomyelitis, tetanus, and rabies once a year, and influenza and rhinopneumonitis twice a year. Pregnant mares were vaccinated for rhino at 5, 7, and 9 months of pregnancy. I never saw a case of encephalomyelitis, tetanus, or rabies, and I believe the incidence of full-blown cases of flu and rhino were decreased in vaccinated horses. However, I was kept very busy treating colic, laminitis, sick foals, and chronic respiratory infections. Around 1990, I read my first article suggesting vaccinations could have some negative effects on horses' health. My initial reaction was one of disbelief and anger at even the suggestion. Once this seed was planted, however, I could no longer deny that vaccinations often did aggravate symptoms in some chronically ill horses. At this time, my roommate and I had 20 horses, and after some soul-searching, we elected to skip their annual boosters. To our amazement, not only did the horses stay healthy, but their health actually improved. Several of these horses had a tendency to colic, and they colicked less frequently or not at all. 2 horses had chronic laminitis, and both of these improved steadily, and one was even able to go back into training. Several of the horses did contract a respiratory infection at a local show, but other vaccinated horses at other barns in the area were also affected. Hair, coat, hoofs, and feet efficiency also improved. About 1 year after our decision to skip vaccinations, we had an encephalomyelitis scare, so we boosted all horses with eastern and western encephalomyelitis and tetanus. Within 30 days, both foundered horses relapsed, and our colic incident was back up. This experience made a believer out of me, and from that point on I advised my clients to tailor their vaccination programs to individual needs and to cease vaccinating any horse with a chronic illness. After 4 years of less vaccination and drug use, I noticed fewer laminitis cases, milder and fewer colics, and overall healthier patients. Vaccinations can overwhelm the immune system, especially if it is weakened already by chronic disease. In healthy individuals, excessive vaccination can actually create a disease state called vaccinosis. Symptoms of vaccinosis can vary greatly but include dry hair coat, weak hoofs, skin eruptions, sarcoids, and warts. There is much we need to learn about the effectiveness of safety of vaccines. Drug companies do not test vaccines to see how long they are effective, so checking titers on horses may be a way to avoid annual vaccinations. Vaccination programs should be geared to fit each individual situation. Thuja occidentalis. This remedy is most often prescribed for the ill effects of vaccination. Its main action is on the skin and genitourinary organs. Symptoms include warts, polyps, lameness in tendons and muscles, which is worse in damp weather, rapid exhaustion and emaciation, chronic nasal discharge, chronic diarrhea, distended abdomen, colic, inflamed ovaries, chronic uterine infection, poor quality hoofs, and swollen glands. Case report. Amy, a 28-year-old Arab mare, was obtained by her owner in February 96. She was in very bad shape but had been gradually nursed back to health. Her weight, appetite, and hair coat were good, but in May of this year she received a puncture wound and needed a tetanus booster. She was accidentally given a combination vaccine containing encephalomyelitis, tetanus, influenza, and rhinopneumonitis. The next day she was very depressed and would not eat. Over the next 10 days she remained depressed with a poor appetite. She was given 1 dose of the homeopathic remedy Thuja 200C, which often matches the symptoms caused by the ill effects of vaccination. Within 24 hours her attitude and appetite were greatly improved, but she has still not fully recovered. Another case report. Carlisle, a 5-year-old warm blood gelding, had a history of skin eruption and warts. He has been vaccinated each year with encephalomyelitis, tetanus, influenza, and rhinopneumonitis. After his shots this spring, he developed painful papilloma warts in his left ear. He became very head shy and could not be bridled in the normal way. 1 dose of Thuja 30C was given because it matched his symptom picture. Within 2 weeks the warts were less obvious and he was not as painful around his ear. Carlisle's tendency toward skin problems and warts suggests his immune system is weak. Treatment from this point on should focus on strengthening his immune system. In September of 1997, Dr. Ward writes, "My experience has been I see more chronic disease in heavily vaccinated horses. I would like to explain why I think this occurs. First, one must understand how vaccinations work. The 1 to 2 cc's of vaccine injected into the horse does not provide protection from disease. This is very important to understand. It is the response of the horse's immune system to the vaccine that determines whether or not the horse will be protected. The vaccine is an antigen designed to trigger a specific antibody reaction, so the next time the immune system sees this antigen, it will react quickly to combat it. This sounds like a great plan and has the potential to work with a good quality vaccine and a strong, healthy immune system. The problem is many diseases don't produce good antigens, and toxic substances called adjuvants must be added to trigger reaction by the immune system. Also, the immunity following many vaccines is very short, requiring injections to be given as often as every 2 months. Would you allow yourself to be vaccinated every 2 months? I would like to make an analogy over the havoc multiple vaccines can cause. Consider the body as a country and the immune system as the army and local police in charge of protecting it. The nervous system acts as the communication network, and the circulatory system makes up the highways. The army regularly protects the borders, and the police keep internal peace. Everything goes well until, without warning, there is a huge invasion of enemy paratroopers. Say you vaccinated your horse for Western equine encephalitis, tetanus, flu, rhino, rabies, strangles, and potomac horse fever on the same day. These invaders use our established highway system to infiltrate all areas of our country. Now we have a very strong army and police force. The invasion will be thwarted. However, border patrol and local peacekeeping efforts may suffer temporarily. This is why it is important to give your horse several days vacation after any vaccine. If, however, your horse has a marginal or weak immune system, a whole different scenario may occur. Because there are no reserve soldiers, all forces are withdrawn from their regular duties to fight the invasion. Communications may break down as chaos develops. In the confusion, orders may be given to attack friendly forces, and they attack the autoimmune disease such as periodic ophthalmia, that is also known as moon blindness. Stressed soldiers may become trigger happy and shoot at anything they see, now we have allergies, or roads may be blocked in an attempt to pin down the enemy, but at the same time cutting off vital supplies to the countryside, laminitis occurs. Even if the war is won, it is often at great expense, as criminals have taken over many cities while the police were preoccupied. In the body we know this as cancer. Remember, even though this is just a vaccine, it is designed to trick the immune system into thinking it is the real disease. With natural infection there would never be more than one disease at a time. It is critical that the status of the immune system and the risk of exposure be considered before any vaccines are given. If you would like to read more about Dr. Ward, she has a website and it is named holistichorsekeeping.com. holistichorsekeeping.com. From a veterinary article on the internet. The death rate in unvaccinated horses is 10% higher than in vaccinated horses. What does that mean? Vaccinated horses die from diseases they have been vaccinated for. Unvaccinated horses die from the same diseases, but only at a 10% higher rate than vaccinated horses. The side effects of vaccinations are tremendous. Is it worth the risk? Every horse owner has to decide this for himself, but the decision should be fact-based and not fear-based. So much about my take on vaccinations. And I would like to go real quick back to this picture where the horse is vaccinated into a large muscle group in the neck. When I came to the United States, I'd never seen this, and I was a little bit perturbed by it and didn't understand why they did it there. However, it didn't take long, and the first horse had a huge abscess in that area. And when horses have a huge abscess, a painful abscess in the neck around the vaccination area, they cannot move that neck because all the muscles work together there, which also makes it difficult for them to eat, to drink, to swallow, and to move. So when I have anything injected into the horse that has to go into a muscle, I prefer to have this done into the chest muscle. It may then be that the horse is a little bit impaired with walking, but usually it is in the chest muscle. It doesn't make a huge impact, even if it does become infected. In the neck, the horse is absolutely miserable. That's just a side comment to all of this. Let's talk about this if you have any questions some more, and let's go on to fly control. If you live in the southeast, fly control is really a big deal. And we have the best results with something that we name fly parasites. The number one preventive against a myriad of pesky flies is to clean up manure. Drag pastures often or pick them, and keep the horse area in general clean. But one of the few holistic tricks that you can do is you can use fly predators or fly parasites. What happens is the fly parasites are gnat-sized nocturnal burrowing insects that do not bite, sting, or harm humans or animals. What they do is they kill flies in the developing pupa, cocoon stage, eliminating the adult fly. Parasites reproduce in 2 to 3 weeks, constantly reinforcing the beneficial insect population. Fly parasites are small flies that are not attracted to humans or horses. Regular flies lay their eggs in and around manure and in wet, rotting places. Fly predators interrupt the pest fly's reproductive cycle before it starts. The female fly predator seeks out the immature pest fly while it is in its pupa stage and lays from 1 to 7 eggs out of a lifetime of a total of 75 to 100 inside each pupa case. As the fly predator's eggs develop, they consume the immature pest fly larva as a source of nourishment. Immediately upon the emergence of the pest fly pupa, the adult fly predator is ready to mate and start the cycle over again. They do not, however, attack mosquitoes and the small no-see-ums. Fly predators are available from arbico.com, that is arbico.com, arbico.com, and some other suppliers on the internet. I have researched this extensively and found Arbico to be the most reliable and the cheapest. How do you apply those? Fly eliminators, fly predators, fly parasites are shipped as parasitized fly pupae in sawdust. Once they have hatched, simply disperse small handfuls or scoops every 3 to 4 weeks on manure piles, underwater troughs, below bedding, corners of pens and paddocks, and feeding sites. Cover with dirt or manure to protect the pupae. Fly eliminators will travel up to 200 feet radius searching for fly pupae to destroy. Another way to deal with flies naturally. My favorite, effective microorganisms, also known as beneficial microorganisms. These can be used as fly spray, can be fed to horses and sprayed in the pastures to enhance the soil and speed up composting of manure. Flies are lured in by decay. Where the environment is healthy, flies have no chance. These beneficial microorganisms are available in the United States at scdprobiotics.com. In Canada, I have found they are available at ecolivingorganics.com. In Australia, it's eco-organics.com.au. And everywhere else they have a huge index. It's emnz.com/index.php/display/89. And when you go to these links, you will be able to purchase beneficial microorganisms. I have written all this down in the November issue of 2009 of our newsletter. You find it on the website under Newsletter Archives 2009, November issue. So if you want to go back and read this, then you can find all this information that I'm giving you now under in this newsletter. The leader of beneficial microorganisms costs around $25 plus shipping. You can make out of this 1 liter 5 gallons of microorganisms, of 4, something in that neighborhood. So you can extend this enormously. And what you do is you mix microorganisms and blackstrap molasses, which again I have found to be the easiest obtainable and rather cheap at goldenbarrel.com, molasses. You buy equal amounts of microorganisms and molasses, dissolve the molasses in hot water so that you have a real even dissolvent, and then put the microorganisms in. The microorganisms don't like to be shook and stirred and turned upside down. They're actually live organisms, so you need to be a little careful there. You can do this, you can produce something like this in a gallon milk jug. In a gallon milk jug you put, I believe it's a quarter a cup of blackstrap molasses, then fill it up with hot water, put the cap back on and shake it real well, leave space for a quarter a cup of microorganisms, put the microorganisms on top, and leave it sitting in a warm space out of the light. What I always did when I still fixed it in milk jugs, I put it in a cooler and closed the lid. You have to go every 2-3 days and burp this because they expand a little bit. And if I had them sitting in the cooler and one of my milk jugs exploded, I didn't have the mess all over the place. I learned things like this from experience. You then go after about 6 to 7 days and test your concoction with pH paper. And it has to be pH paper in the microfine 2.8 to 4.6 range. And when your microorganisms are anywhere below 3.7 on the pH paper, then they are ready to use. And I know they say in the literature that you should use them within 2 weeks. I found this absolutely not to be true. They are very usable for weeks to come. And I brew mine in a 9-gallon vat. And I use this. It's a fermenter. And it's available at eckrause.com. And this is the entire link, tt090.html. But if you just go to eckrause.com, which is a wine-making, they outfit you for everything you need for winemaking. So what I like about this is, my personal one is a 9-gallon container. I fill in half a gallon of molasses, fill it up with hot water, stir it real good, put half a gallon of microorganisms on top, close the lid, and it has a air vent in here where no air goes in but it can get out. So you don't have to burp this. It's very clean. It's very easy to deal with. It's not very expensive. I think it runs around $35-40. And it has a spout where you can let it out into another container that I then use in the barn. I use this virtually everywhere. I use it to spray the horses. I feed it to the horses. I put it a little bit in their drinking water. I spray, since I have a lot of rubber, when they pee on the rubber, it really smells especially bad in the summer. I spray this on the rubber and the smell goes instantly away. We use it in the pastures, and we have been using it when we still cut our own hay. Much to my delight, we have quit this now. But we sprayed it on the windrows, and the hay really came out a lot better before we baled it. So it has a myriad of uses. What it basically does is microorganisms keep everything that you want to be healthy, even healthier, by decay, by speeding up decay. So they go ahead and they compost everything faster. You can even put it on your compost pile and it will turn around much faster. And it works very well for fly control. And every year that you use this and your horses become more resilient and their immune system becomes better, the flies are less interested in them. I have virtually no flies at my property. So, but there is more to this. It's not just the microorganisms. One thing that you cannot control with all of this are these pesky little mosquitoes. Somewhere, I think further up north, there are big mosquitoes, but we have small ones and they bite very much. There is something out there that's named Mosquito Magneto, and it can help with the controls of mosquitoes. We have tried that for a few years and it did work. Again, the same company that sells the fly predators, arbico.com, arbico.com, and no, I do not get paid by them. They sell an organic granulate that can be sprinkled on standing water and controls the reproductive cycle of mosquitoes. The same like with fly control, cleaning up all stagnant water that is not used helps to prevent a huge mosquito problem. I put this Arbico mosquito control in our foot spas, and it helps to kill off the mosquitoes, and my horses drink out of the foot spas, don't ask me why, without any side effects. So here again is the cover of that newsletter that I wrote, and it has all the dilutions, everything that you need to know. Because once you have brewed the microorganisms, you still do not use them except in feeding and in wound care, but you still don't use them full strength. There's one other thing that you can use, and this is named the NCI trap. I'm not going to go into details about this. I haven't built one. I don't have a lot of experience with it, but it seemed to have a lot of promise for fairly little money. And if you go to ncitrap.com, you will find all the information. They have building plans on there, how you can build this very effective fly trap, and I believe it is also effective for deer flies and the big horse flies. So that is something to be considered as well. Equine parasites. They come in many sizes and shapes. Some commonly grow to 20 centimeters in length and can even reach 50 centimeters. That's half a meter or more than half a yard. In sufficient numbers, they can cause a potentially fatal intestinal blockage. Many are very tiny indeed and can be present in their millions. Some develop into highly efficient egg-laying machines. Infected horses can be passing out millions of eggs a day in their feces, supporting a parasitic life cycle that will see other horses infected. Most parasites take up residence in a horse's gut. It's not difficult to see why. There's a plentiful supply of nutrients, and access is pretty easy via the horse's mouth. Exiting presents few problems either. The eggs simply pass out in the feces, or in some cases the mature parasite simply lets go of the gut wall and journeys out through the intestine and into the pasture. So what can we do about this? Most important, cleaning up and composting. Because composting develops heat, and in a very well-maintained compost heap there is more than enough heat to kill parasite eggs and larvae. You can also, this is another parasite, they are named bots, and you can go ahead and clean up the bots with a bot knife, or I use my hoof knife to just shave them carefully off of the horse's leg. But you have to be careful that you really get every single one. And again, it is amazing how horses that have a strong immune system do not seem to have a lot of parasites, including bots. It seems that the bot flies do not like to lay eggs on them the same way they do on horses that are compromised in their immune system. I see this here in the clinic all the time. Our horses are out, the clinic horses are out too, and those horses that are really compromised, they tend to have a lot of bot fly eggs on their forelegs. The cycle, the way that goes is the horse rubs his nose on the foreleg and inhales these bots and also gets them on the lips, and as soon as there is warm moisture, the bot egg lets go and therefore gets into the horse's mouth and then into the intestinal system. So this here is this is the sign of pinworms. When horses scratch their behind really bad, if you see a horse scratching the tail, I just want to mention this here. It is not always pinworms. It also may be that the horse has a very dirty udder in mares or a dirty sheath and beans in the on the penis, so that they really start itching incredibly, and then the only place where they can scratch is the tail to relieve that. And so always check this before you think the worst, that your horse has horrible parasites. Usually you can see if horses have horrible parasites. Their coats aren't good. Their vitality isn't good. And yes, I do believe in chemical wormers, but only after I have done a fecal check. Only after I am absolutely sure that I can use, that I really need to worm, and if I know for what to worm, because not all wormers are created equal. And I test my horses on a regular basis, and we talk about this a little bit later, with what I test. I don't test with a fecal exam. And my horses do not come up with any worms. No strongyles, no ascarids, no oxyuris, nothing. So please have a fecal exam done before you put a chemical wormer in your horse, because chemical wormers are also toxic. They kill the worms, but they also kill a lot of other things, like good beneficial bacteria in the gut. If you have a horse with a large worm load and you go in with a strong chemical wormer, you also need to go in with something like Metamucil to clean this horse's gut out in a hurry. Because if you go in with, if this horse has a huge worm load and you go in with just a wormer and the worms do die off in the gut, they become toxic to the gut. And then you have a new problem. So with a strong worming program, I always use some Metamucil or something like that to clean everything out. Yes, they will have diarrhea for a day or two. That's the least of their problems. Okay. Another thing that we see a lot is lice and ticks. And again, a horse with a healthy immune system does not have a big problem with this. I have not seen lice in a healthy horse. I see ticks seldom. And we have a little bit of woods. I know that a lot of horses are allergic to ticks, but then again, you have to look what triggers the allergy in this horse, and there may be more to this. And I tell you a little bit, if we have time at the end, about how you can combat this. Okay, next, this we have to fly through this, otherwise we don't get done today again. You need to encourage horse owners that you take care of, and you need to do this with your own horses. You need to know your horse's baseline. The temperature of your horse, of a healthy horse, should be 100.5 degrees Fahrenheit or 37 degrees Celsius. The pulse rate, if the temperature is below this and significantly below this by a whole degree or more, you have a metabolic problem and you need to work on this. The pulse rate should be 36 to 40 beats per minute. Respiration should be 12 to 16 breaths per minute. Capillary refill time, if you push your thumb against the gum above the teeth, you get a white mark and it should refill in less than 2 seconds back to pink. And the mucous membranes should be pale pink. Now this sounds all very logic, and how many people really do this? I'm not going to ask you. But do you know the temperature, the pulse, the regular respiration rate of your horse? If they are a little bit elevated or below, that doesn't mean you have to panic. But if you know this, if you watch your horse that he always has closer to 16 breaths per minute than to 12, maybe he has 18. But he always has this. This is normal for him. Then you become less alarmed if it goes up to 20 than if his regular breaths are 11 or 12. That's what I'm trying to say. If you know your horse's temperature is 98.5, you have to do something nutritionally to speed up his metabolism, or you're going to run into problems down the road. This just to have you check this, and also educate your clients about this, that they check it. When the veterinarian arrives in an emergency situation and you say, my horse has usually a pulse of 36 beats per minute and now he's at 120, that gives the veterinarian a much better way to deal with the situation, and the same with everything else. Okay? Let's talk real quick about when to call the veterinarian, and I really think we have to be very aware of when this is important. Call a veterinarian. Call a veterinarian immediately when there is heavy bleeding from any part of the body and the bleeding will not stop. When there is blood in the urine. When the horse has difficulty breathing, gasping, noisy, distressful breathing, blue tongue. When burns are fairly extensive. The horse is choking or appears distressed, extends the head and neck, salivates, coughs, grunts, strikes the ground. When food and saliva may be regurgitated through the nostrils. We name this choking. When the horse collapses or has loss of balance. Overreaction to an external stimuli with one or more of the following. Depression, staggering, knuckling over. Walking in circles down and unable to get up. General muscle tremor with or without sweating. Rigidity, paddling, movement of legs, shock or coma. Diarrhea, putrid smelling, fluid diarrhea with or without blood or severe abdominal pain. Severe injury with continuous pain, severe lameness, lacerations with bone exposed, puncture wound, especially on the chest or abdomen. Uncontrollable biting, itching, tearing at skin where skin has become broken and bleeding. Severe pain from continuous or spasmodic colic. Severe abdominal pain. Continuous or spasmodic, unable to pass feces. Poisoning from chemicals, snake bite or poisonous plant ingestion. Try to retain a sample of the poison for the veterinarian if possible. Straining continuously with little or no results. Horse positions themselves to urinate or defecate without results or exhibits pain. Difficulty in breathing. Severe lacerations or punctures. Again, this was the list of when to call the veterinarian immediately and have a relationship with your veterinarian where he knows that when you call and you say, I need you here now, that he knows you're not crying wolf, that he knows it's really, really serious. When I call my veterinarian and say, I have blood all over, or I need you here now, this horse is not in good shape, and explain it to them, they know this is serious, they really need to come. Call the veterinarian the same day if you have discovered a miscarriage of a fetus, if the afterbirth is retained for longer than 8 hours after delivery. Signs of appetite loss along with depression, painful breathing, diarrhea, lying down, sweating, or obvious pain. Difficult breathing, labored breathing, rapid and shallow breathing with or without cough. Diarrhea, no stool formation, mostly fluid eye problems, tears streaming down cheeks, eyelids partially or completely closed, cornea surface of the eye scratched, hazy, opaque, or bluish-white appearance. Frostbite and hypothermia, low body temperature, usually occurs in sub-zero temperatures. Injuries that are not urgent but liable to become infected. A cut through full thickness of skin, needing stitches, puncture wound on foot or sudden acute lameness. Swelling that appears hot, hard, and painful or is discharging. That is when you should call the vet the same day. In the following, you will monitor and wait 24 hours before calling the veterinarian. Appetite loss, horse isn't eating but offers no other symptoms. Diarrhea, loose stools with no sign of blood or straining and no abdominal pain, moderate itching with no surface damage. Lameness but maintains ability to bear weight on the leg with no other symptoms. Excessive thirst often accompanied by excessive urination. Again, wait 24 hours and monitor it. Monitoring also means check the vital signs of the horse. Now I have a few more things to tell you about what we call adjunct therapies. This is not usually the veterinarian's domain, but there is a lot of yours truly, the instructors in equine soundness, that they can help you with, because we all took on, after we graduated from trimming school, we took on some other modalities to help horses. And the first one is help for colic and to balance your horse. This is the website of Audrey Bryant in Washington State. She's not on the call today. Usually she's here in the morning. I think she just came back from vacation last night. She might not be ready for business yet. but Audrey has developed a colic kit that has several very helpful homeopathic remedies and tells you exactly what to do when your horse starts to colic. And I think this is a good idea to have here. I had, while she was here with me visiting, I had a horse colicking, and she just asked me to mix those remedies. Remedies I've plentiful, to make a mixture of these various remedies and give it to him. And then she also used this red light that you see here on the left side. They come in different forms, and we all have one, and use that on certain colic points. That way you can help your horse, and if it is just starting out as a mild colic, it may never develop into anything. It is always something to try. I have tried this, the light therapy on a horse that started out with a colic, but since he was not mine and he was an older horse, I called the vet anyway, and when the veterinarian arrived, she said, "Well, Claudia, I don't know, this is a very mild colic. I wouldn't even give him any Bannerman or anything anymore." So this is kind of what you want to hear. This light is doing the same trick. The one that Audrey sells is doing the same trick that the red light, photonic light from Dr. McLaren does. Dr. McLaren's light is meanwhile $800. I think this one is either under 100 or just around 100. So, and it comes with a CD where you have all the points of the horse that you can treat. And just treating your horse for balancing with the light helps tremendously in his vitality and staving off problems. Just going over the horse once a week, over the general points and treating them. Sure, it's something you have to learn. But it's not hard, and this particular light has a pretty wide influence. So if you're not exactly on the acupoint where you should use it, it really gets you there. And we had talked before about meridian points, and you can treat them with this light as well. You also can do acupressure, but you have to be a lot more precise. And it's another whole learning curve. The other thing that we need to keep in mind, and it has a direct influence on the feet, interestingly enough. And this is something that our instructor Jerry Schmidt is extremely good at. In fact, I hired, before he ever did my horses, the instructor of the school that Jerry went through did my horses. And after Jerry did my horses the first time, because he was here, and some of the problems that the horses had exhibited after his instructor had done the horses were gone, and they were gone for good. He's extremely patient with horses. He is extremely careful and has good handling skills and does do a lot of good work. We do not believe in power tools. We have found that horses that were done with power tools and excessive sedation, which you have to do when you do power tools, do usually become lame a few months afterwards. So there is a connection between the abrasion and the heat of the power tool on the dental surface and the lamina in the foot. So you have a link there. Jerry does travel the entire United States. He also has been to England, and I don't know what the deal is next with Australia, but he's going around, and go to his website. It's NW for Northwest Equine Dentistry.us. And you will be able to read a little bit more about what he does in general. Also, if you go on that website to the bio page, you will find a PowerPoint presentation that is excellent. I can vouch for this. This is really giving you a whole new outlook on equine dentistry, if you haven't seen it already. And finally, I want to tell you, this is the only time, a little bit about the BioMeridian machine that I have. Actually, Audrey has one too. Or I should say, Jerry has one and Audrey operates it. Because Jerry doesn't have any time anymore, and they live close to each other and work a lot together. So Audrey offers the same services in the Northwest that I offer here in the Southeast. This is a testing device that tests the acupuncture points of the horse for their conductivity. And it is connected, this testing device is connected to a virtual library with 40,000 plus remedies, medicines in it. And it also, I also can test on this for parasites, for vaccination residues that have no use in the body. I can test for all kind of nifty things. I do usually a general testing, and I use as a medium for this testing hair. In the past we used blood, which was extremely difficult because I had to actually travel to the horse and do the testing right there, and putting the blood on the test plate and then testing my own acu points to get a result. It then turned out, as I became more advanced in this technique and met other instructors, that we also could test from saliva. Now it got a lot easier because you can actually send saliva in a plastic bag. But then in the end, in the last advanced seminar, I got told that I can do it from hair. And I tried this with my own horses first, and the hair works just as well. But I need to have the hair within 3 days of it being cut or pulled. I use mane hair because it grows back the easiest. You just send me a pencil thick piece of hair via priority mail, or if you live far away, via overnight mail, and I test it and send you the appropriate remedies for your horse. And that way, this does unfortunately not do if you only do one round. You have to do several rounds, and but we can take care of the parasites care. We can get the immune system to function better, because homeopathic remedies will pull the toxins that are in the body out and detoxify the horse. And if you have a horse that becomes over time, either they don't become free of toxins, but if they have a very low toxin load, they have a better immune system. And I think this is very logic. We got put onto the system by Todd Morrell, who was our instructor in the hoof school, and our main instructor, and he wrote the equine program for this particular machine that we have. And we all have also been to practitioners who use this on humans and have been able to get toxins out of our bodies, which made a huge difference. The problems that we had in the past, I only will speak about my own because it's not fair to speak about others, and not right. I had very heavy mercury poisoning from childhood vaccinations, and by the time I started to turn 50, I was almost not capable of moving anymore. I spent most of the time laid up in bed and had really a hard time living. And after I went to British Columbia to a very good doctor that uses this kind of testing, and he started to get the mercury out, I became gradually better. And what do you know, I'm still working on it, but I feel a whole lot better, and so will your horse. So if you want to consider this, again, there is a PowerPoint. There's a lot of information on the hoofcareunlimited.com/msas.htm. And I think that was a lot today, and thank you for listening, and we shall take questions now. Yes, Shira.
I actually had several questions.
Yeah. Could you speak up a little bit?
Sure. I'm sorry. Actually, let me check my computer settings just to make sure it's... Can you hear me okay?
I can hear you, but I have to really listen close.
Okay, give me 1 second. How's that?
Oh, that's much better.
Okay. I do have several questions. My first question is, with vaccinosis,
Yeah.
are you looking at the potency of the Thuya depending on what the symptoms are for the vaccinosis, or do you just recommend a specific potency for vaccinosis?
That's a very difficult question. I'm not trained in homeopathy to that extent. All I know is that when you have something extremely acute, you use a lower potency. If you have something that is already existing for a while, you go to a higher potency. What I do, and again I do this with this machine, I make a so-named homoquart. I put all kind of potencies in it, and if you have a 6X, a 30C, a 200C, and a 1M, I would put those all together, and because the body sorts it out.
Okay.
The horse's body will pick which potency it needs to help. That's what I know.
My second was more of a comment. I was just writing down things while you were talking. I do have experience with a horse who came down with laminitis after being wormed for parasites that he tested positive for. So I just want to put it out there that chemical wormers, if you are worming a horse who is not metabolically healthy, even if they have parasites, the chemical wormer may not be the best thing for them at that time. And very often, like Claudia said earlier, the parasites are a symptom of something else going on. A healthy horse does not have parasites. So sometimes you need to get the horse healthy before you can then deal with the parasites. Or you need to look for another way to do it that's not going to be so toxic.
Right. You can use in that instance a herbal parasite, an herbal wormer, or you can use diatomaceous earth, which helps in some instances with the deworming process and is absolutely not toxic to the horse. I agree, every horse that's metabolically challenged has problems dealing with any added toxin. That goes so far that I think betadine scrubs for ringworm can do a horse under if this horse is already extremely metabolically challenged. So you have to be very careful there. Thank you for that, Shira.
And then I had two other questions for you. I know you mentioned using mane hair for the Biomeridian machine. Can you use tail hair?
Yeah, if you have plenty of tail hair, makes no difference. It's a energy testing.
And my last question was, who uses it for humans? Do you have a name or?
Oh, tons of people. I have a practitioner. I drove for 2 years to a practitioner in Ohio. There is one in Arizona that is excellent. Actually, you just have to look around. You can call Biomeridian. They are on the internet under biomeridian.com, and there's a contact number, and just call them and ask them who in your area has a machine. Now, not everybody uses it the same way. And you're welcome to contact me privately, and we can talk some more about human uses.
Great, thank you.
You're welcome. Was that it?
That was it.
Already? Okay. Thank you, Shira. Carla. Hi, Carla. Let me just say something about Carla, because she's the first time on the morning call. I don't know, she's going dancing tonight or something like that. And Carla is a colleague of ours and has graduated in April from the course at Equine Soundness. Welcome to the morning call, Carla. You're on.
Thank you, Claudia. I wanted to ask, when you are spraying your horse directly with the microbes, do you dilute that, and if so, which dilution do you use? And as well as when you're spraying an open wound on the horse, which dilution do you use?
On the open wound, I use it full blast.
Okay.
And on the as a fly spray, I use the whiskey rule, 2 fingers in the bottle of microorganisms, and then the rest is water. There is no scientific. I don't use a scientific method for this. This is what I'm trying to say, but it really works. Are you brewing now? Are you ready?
Yeah, I checked mine a couple days ago, and I was right around, I thought it was 3.9, but it may be 3.7. So I was just waiting a few more days for it to get below that.
Yeah.
But I've been brewing them since, I think, July the 6th is when I mixed them. So it's taken a while. I don't know why, and I'm using the container that you have, so I'm not sure why it's taken so long. And it's in a room that's not air conditioned.
Yeah. Huh.
But
I can't tell you. It's one of those things. And it's not that every batch that I ever have brewed came out brilliant. I remember that I brewed one that came out that I thought when I opened the container, I die. It smelled so bad. And I threw it in my vegetable garden in disgust. My vegetables really liked it. The tomatoes came out one like the other. There were no size differences. They absolutely perfect, and we had more tomatoes than what we knew to do about. But not every batch comes out perfect. So when you start out with this, maybe you should go for the milk container in smaller batches. But just give it a try, and if it doesn't come down, use it anyway.
Okay. Well,
okay.
I mean, it should be ready now, but it stayed around 4 for a long time, but now it's come down to 3.7. So I'm hoping the next time I check it, which will be tomorrow.
3.7 is good. It's good enough.
So I can go ahead and use it at 3.7.
Yeah.
All right. Well, then tomorrow I'll get to using it.
Okay, very good.
Thank you.
You're welcome. Chris, a penny for your thoughts? Chris?
Good morning.
Good morning, Chris.
Sorry, it takes me a while to turn my mic on. I have other noises I don't want to disturb others with.
Great. Thank you.
Actually, one quick question. It's from last week. You had those large hay bags for full bales.
Uh-huh.
Can you direct me to where I can find them?
Nylon net, I think it's .net or .com. The other one, I have put actually on the Yahoo group a resource page up.
Okay. I don't know anything about the Yahoo group.
Yes. Let me see. The Yahoo group was started in the very beginning, and I sent everybody an email, and maybe because I sent over 50 people an email, it went in your spam folder. That could be. I will send you, I make a note of this, and I will send you an invitation to the Yahoo group when I'm done with this call.
Thank you very much.
And there you get the articles. There's the article on it about quality of life from last time, and there is a resource page with the HayNet resources. I think I put that up, but I will check, and if I haven't put it up yet, I will put it up today.
Super, thank you very much.
Thank you, Chris. Kathleen, how are you today?
I'm fine, thank you. How are you?
Thank you.
Good. I've actually sort of my head is spinning and I'm trying to take it all in. I was thinking my sister has a horse farm back east, and they, when they first got the farm, had some horses. One was pregnant with a very high-end foal, and they lost the foal. I think it was stillborn and had gotten a rhino virus, and I think this wasn't vaccinated. So I know you should do individual case-by-case basis in terms of vaccination, but are you saying that in general you shouldn't vaccinate a pregnant mare, or what?
No, what I'm saying is you should find a veterinarian who knows and believes in the dangers of vaccines and can direct you in the right way. Like I have a veterinarian here in South Carolina, Dr. Amy Hayek, and she would rather not vaccinate, but she takes this on an every case basis. And she goes through the barn and looks at the horse and actually muscle tests the horses and sees if they need it, if they don't need it. She checks the immune system, and she educates people about the dangers and the benefits of vaccinations. That's what I want you to do, and not just to go, oh, the veterinarian said I should vaccinate. And I think it's very important that I mention this. Thank you for bringing that up. There was a study done not too long ago that found that veterinarians in general make 40% of their entire income from vaccinations. So if they give this up, that will, and re-educate their owners, that would put a huge notch in their income. And not everybody is in this for the well-being of the horse or the animal. Some are in this for the money.
Right.
So, or they have becoming used to it. You know, I don't know what drives them. But what I'm really saying is find, and you shouldn't have too many problems in California to find.
I agree. Actually, I have great vets, so I'm
Yeah,
with that.
and they are everywhere, but you have to look for them. And there are actually, when you go on the internet and look under holistic veterinarian and homeopathy, things like that, you get to directories where these veterinarians are listed.
Okay. I
Okay?
have one other question. It's just sort of a general question. I was at a show barn before my mare got hurt, and I'm still riding her. And the woman who ran the barn, the trainer who ran the barn, you had to follow her protocol for vaccinations and health and all that, and treating for West Nile, and she was very adamant. And like I said, I'm not at the barn for a lot of reasons, but she wanted a whole list of vaccinations done on all the horses at the barn, and to be at the barn, you had to follow what she said. So what do you do in those situations aside from move?
There's a couple of things that you can do. Number one, and in no particular order, and I'm not saying which is my preference. Number one, you can lie about it. You can take your horse off the property when you go somewhere to ride with some friends or whatever, and say, oh, by the way, the veterinarian was just there and my horse got vaccinated. That's one way. Another way is to educate this barn owner and say, I just print this article from Dr. Ward out and on holistichorsekeeping.com and go to a barn owner like this and say, I just found this. I really would like to have your input on this. I don't.
That's not going to happen.
No, but for some people it works. Look, it worked for me. I had a conventionally run barn and somebody gave me a book about barefoot hoof care and needled me endlessly to read it. So I read it and I changed. So why not others? It's worth a try. And the last option that I can think of off the top of my head at this moment is if somebody insists that you vaccinate, but only one vaccination at a time, and not 5 and 6 at a time.
Right.
One at a time, then give it 4 weeks, then give it another one. And say, I'll be more than glad to have my horse vaccinated, but they need to be vaccinated, one vaccination at a time. And again, all this holistic stuff takes more input from you than going with the flow. And that's always like this. If you start eating organic and raw, it becomes a whole different story than if you just go to the around the corner convenience store and buy everything that they have in a package on the shelf.
Right.
If you start to keep your horse barefoot and out, and there's all of a sudden, it is not easier. I don't think it's easier. I'm still thinking back to the times when I went out to the barn and I knew exactly where to find every horse. It was in his stall. And all I had to do is pull him out, put him in the cross ties, brush him down, put a saddle on, and ride away. Now I go out, they are sweaty, they have just rolled because they were sweaty and they wanted to get the flies off. They have rolled in sand. Now the sand really sticks well on sweat. They are on the other side of the property. I have to hike there before I can get the horse. There's all kind of inconveniences. But the other thing, when I look out the window and I see my horses standing in the pasture grazing and being totally at peace with themselves, that beats every horse that I see looking over a stall door and saying, can I get out now? Yeah? So I feed my dogs raw. It means I have to find chicken. I have to freeze it. I have to unfreeze it again when it's time to feed it. It's a whole different world. And some people choose to go that route and others don't. But one vaccination at a time if you're at a barn where you, and maybe Shira has another idea about this.
Do you do the same with your dogs?
I don't vaccinate my dogs. They don't leave the property.
Oh.
And if, if I have an accident with the dog, I haven't had any with these dogs, but with a past dog, I had an accident, and I just said they were vaccinated at a different vet. No, end of story. Who's the wiser?
Okay.
With the cat, I just said it's a barn cat. I only can catch him when he's sick. I can't catch him to get him vaccinated. So, and the veterinarian I use doesn't put a fuss up over it. Okay? You're welcome, Kathleen. Shira, you have your hand up.
Yeah, I had a comment, which is the other option is to have a veterinarian that you can talk with who understands your point of view, and who will write an exception letter for your horse.
Yes.
Which I got done with my thoroughbred. It is the law in New Hampshire to have a rabies vaccination. I cannot vaccinate him at all. So my vet in New Jersey, who was very pro-vaccination, looked at him, heard his history, and said, "You're right, you can't vaccinate him," and wrote me a letter for him.
Okay.
And
The other, sorry.
at some point in his life, he had been vaccinated, which I had, and she was more than willing to write a letter saying he can't be vaccinated.
Okay, that's great. Good advice. Thank you for that. The other thing is you can actually pull titers on the horse and have them tested and figure out which vaccinations are still working in the horse and which need to be repeated. And that makes a big difference often that horses, like we tend to vaccinate horses every year for tetanus, but we vaccinate ourselves only every 10 years for tetanus. And not even that, if I'm honest. I don't think I had a tetanus vaccinations in the last 10 years. So, and when did you see the last time tetanus anywhere? That's the thing, when did you see the last time, when was there the last time of full-blown rabies in a horse? I know what the veterinarians say. It's because we vaccinate it doesn't happen, but vaccinations do not prevent the disease. They diminish the symptoms. So thank you, Shira. Carla.
I was just to speak to the point you just made, Claudia. I have had really good success working with my vet drawing titers because to minimize vaccines, and I get the usual spiel about how the titers are not always reliable, but I'm much happier drawing a titer and gauging based on the results of that I cannot give the vaccine and still be okay, rather than just vaccine, which is what that's their standard of practice. And so I just thought I would put an additional plug in for the titers. I'm glad you mentioned that because I've been doing that and it's been really good.
Okay.
It's a little pricey, but it's better than giving them all these vaccines.
Well, you know my stand on pricey. If you can afford to have a horse, you should be able to afford to take good care of it. If you can't afford that, you shouldn't have a horse. Horses are expensive. Every time I breathe, I have to fork out some money for my horses. And it's a never-ending story. If you have a dog and the dog weighs 50 pounds, just think about it that your horse weighs more than 20 times as much. So if you spend $10 on the dog, you have to spend $200 on the horse. That's the way it goes. They eat more, they coast more, and when I sink my nose into their fur, they give me the most pleasure. And that's what it's all about. So, and Carla mentioned something that I think is really important and should be important for every single one who's listening to this. It is about what you believe. If you say, that was all good and well, but I really believe my horses should be vaccinated, then your horses will be vaccinated. And if your horse gets a reaction to the vaccination, you will deal with this accordingly in any way you can. I have been to a massage seminar and found on one of the horses, when I went in the stall to work with her, a huge abscess on the neck. And the owner said, well, that's the way it goes. Sometimes you win, sometimes you lose. And just don't go there while you're massaging her. And she was meanwhile giving the horse steroids, or having the vet give her steroids in order to deal with this abscess that was on the horse's neck for 2 months now. And she was absolutely willing to deal with this. All her horses looked bad. I didn't see a horse in the barn that looked healthy. They all had something on them that spelled, I'm not quite well. And but that was totally okay for her. She just said, I have all rejects and I have all horses that are not well, and that's the way it is. So I'm not saying you have to do the one or the other thing. This is all about educating, not about teaching you what you have to do. After you are educated, you can make your own choices. And now we're going to go and hear if Trish has something to say before we get off. Trish?
Yes. Can you hear me?
Excellent.
Oh,
Loud
good.
and clear.
Good. For some, you know me and my computer, for some reason I couldn't get the picture today, so I didn't even know if you could hear me or not.
You couldn't get the picture today.
I don't know. I had a computer person with me all day yesterday, and maybe we'll just get another computer and I'll go to computer class. But anyway, that's how it is with my story and computers.
You didn't miss much. The pictures went the main subject today.
Well, are we back online with being able to review the classes now, Claudia?
You have been able to review the classes all the time. It goes back in I sent you an email, and either it goes in your spam folder. You know, spam folders are not for you to ignore them. Spam folders are for you to divide between what you have to take care of right away and what may not be so important. But eventually you have to look at your spam folder and look at if you still have a problem, I sent you, do you still have a problem?
I haven't tried today. I had sent you that note yesterday, so I haven't tried again today.
I sent you an answer to it this morning.
Oh, thank you. Then I will look at that. Thank you.
The URL had changed a couple of months back, and the sign-in had changed, but it works every time I try it. It works perfectly.
Okay.
So.
Thank you. I will try again.
Okay.
I really appreciated. We have been looking for a more, I guess you'd say, a more holistic type veterinarian, and have not had that success. So going online was a real good hint for me.
Okay.
To try and find somebody. So I appreciate that immensely.
Good. You are in Washington, is that correct?
We're in Oregon, in the northwest corner of Oregon.
For somebody who comes from South Carolina, that's all the same.
Right.
I actually have a couple of contacts in Oregon.
Really?
Who are veterinarians, but not horse veterinarians, but they may know somebody. And
okay.
Send me an email, and I send you their emails.
Oh, thank you.
And
You
that's
bet.
where you can contact them, tell them that I sent you, and if they know somebody. That's
Thank you. I'll do
another
that.
option. Yeah. Okay. Very
Thank you
good.
again. Good class.
Thank you, Trish. You're always so kind. Thank you, everybody, today for coming. I enjoyed it, and I see you next week. Have a great day.